Everyone. Good evening, everyone. I am Mrs. Lindiana
Good
Raming.
evening.
Good evening.
I am Mrs. Lindiana Raming, President of the Bahamas Diabetes Association and Bahamas Association of Diabetes Educators. I am also your host for this evening's meeting. Thanks for joining us at Feet4Life, online diabetic foot monthly webinar. 1 week ago, we celebrated World Diabetes Day under the theme Access Diabetic Care, which means providing required care for diabetics patients to support and manage their diabetes and prevent complication. It is also an opportunity to increase awareness of healthy practices and new medical treatment to better manage diabetes. We will talk more about this in our meeting. My apology. I trust you had a beautiful day. Welcome, everyone, especially those visiting from the Family Islands and our friends from the United States and around the region. As usual, we have an informative meeting planned for you.
Are you on?
You will receive, please mute your mics. As usual,
It starts.
Indiana, you're muted. We can't hear you.
oh wow. So I need to start over. I need to start over. Okay. So I trust you had a beautiful day. Welcome everyone, especially those visiting from the Family Island and our friends from the United States and around the region. As usual, we have an informative meeting planned for you. You will receive a lot of information that will help you improve your overall health, manage your diabetes, and care for your feet. Please remember to mute your mics and put your questions in the chat. We will answer them after our presentation. Our YouTube channels, please call Feet4Life 242. It's up and running. Go over to the channel, like and subscribe so you get a notification every time we put up a new video. You can watch all of the previous videos as well. Again, we are live on Facebook at Family Foot Center. That's Family Foot Center. Our meeting is growing thanks to your continued support and attendance. Thank you for sharing the invite and for attending. We have persons joining from all around the Bahamas, so please tune in. Let's begin with a short devotion and a word of prayer by Pastor Leonardo Raming, Secretary of the South Bahamas Conference of Seventh-day Adventists Church.
Good evening, everyone. It's a joy to be here with you this evening. And I just want to share with you a brief devotional thought. And I want to start with a thesis statement before I begin, and then I will pray. The truth is that Jesus touches us in our brokenness. And I want you to remember this. Jesus touches us in our brokenness, and he places us upright in his powerful love. You know, I believe that you and I are always blessed that our Father, our Creator, Jesus Christ, he opens our eyes to the very same encouragement that he gives to his servant Daniel. The truth is, we know that he loves us And every time we cry out to him in our distress, we are assured that Jesus will respond in the affirmative. And so we see Daniel as an example of faith under fire in the Word of God. You know, as we look at the Word of God, and I want to share with you what text I am looking at tonight. The Bible states in Daniel chapter 10, and I will not read all of it because I don't have the time. But the truth is, as we look at it, we see Daniel as an example of faith under fire. And although our circumstances may be different, we too oftentimes see havoc coming upon us. You know, what am I talking about? As we undergo illnesses, distress, loss, and heartache in our lives, and in the lives of those whom we love, we have the possibility of crying out to Jesus Christ. And therefore, we have hope as we read Daniel chapter 10, because we see that God always sends comfort and he sends reassurance when we cry out to him. In Daniel's vision of what will happen to his people in the latter day, it was very devastating. But the truth of the conflict in the vision causes him to lose his appetite and even mourn for 3 weeks, 3 whole weeks. You know, when we receive devastating news or we have to undergo health crises, when the doctor tells us that we have diabetes or we have a heart problem or we have cancer, whatever the situation may be, Daniel sees, we too become weak and wondering. But Daniel sees the messenger of God coming to reassure him in his time of need. And he is terrified because Daniel is a human being. He's terrified. But guess what? Daniel falls to his knees. And he displays an example of where you and I ought to be before the Lord every time we have a challenge. If we have diabetes or we have a problem with our feet, guess what? We can too run to Jesus. You know, moreover, emotional pain and heartache from physical loss can take our breath away and remove even our words. However, when you and I come before God trembling with our devastation, God sees our misery and he knows what to do about it. The truth is that the doubt, the fear, the debility are laid before him. And even though we can't see everything that's going on, we must understand that we are still exposed before God, and God, knowing our vulnerability, we will submit to him. He will work out everything for us. And so as I leave with this, because as a result of what we pour out to God, as a result of us slowly pouring out to God what our desires are, what our needs are, I want to remind us this evening that when God answers, he will always answer with a soothing and calm response to give us a soothing balm to our tumultuous emotions. God hears our cries. He sees everything about us. And God is able to pick up the pieces laid before him, and he can put them back together again. So whatever you're going through this evening, whatever your concerns may be, trust God, lay it before him, and God will give you that soothing balm that you need in your time of challenge. Let's pray together. Father in heaven, thank you so much for what you have done and what you will do in this presentation this evening. Thank you for the information that we will receive, and thank you for the knowledge that we will receive. And God, I'm asking that you will help us to not only listen, but help us to be willing to apply the knowledge so that we become healthier individuals for you. Help us to know that no matter how difficult our experience may be and how challenged we may be, that you are able to give us that soothing balm that is able to relieve all of our stresses, all of our pains, all of our challenges. We're dependent upon you even now. In Jesus' name we pray. Amen.
Amen. Amen. Thank you, Pastor Raman, for an inspiring devotional. Thank you. Among diabetics, for complications are some of the most common, most costly, and most feared when it comes to diabetes seconds cost. Every 1.2 seconds, someone develops a diabetic foot ulcer. Every 7 seconds, someone dies from diabetes. Every 20 seconds, a limb is amputated due to diabetes. Here in the Bahamas, we continue to see our number of complications rise, and in young and younger people. We have to do something to stop it. We start this Feet4Life online diabetic resource to increase awareness, education, and skills to help patients, family, caregivers improve their management on the diabetic foot. We are convinced that working together, we can prevent amputation, save limbs, save lives. Only then we will realize our vision for persons living with diabetes to have their feet for life. Coming in 2024, we will host the Diabetic Foot Lay Educators Seminar again. So listen up and plan to attend. Before we get to our speaker, we always have a Take Control Minute, which reinforces the importance of controlling diabetes and promoting overall health to prevent complications. Our Take Control Minute is a video on World Diabetes Day. So you want to play this video?
1 second, I'm queuing it up right now.
Okay.
I'm still not the best on this yet.
Yes, so just listen and tune in.
Can you hear?
No, not yet.
Okay.
Before you do, you gotta share sound.
Okay, all right, awesome. So go back to the screen.
Go back to the screen, take it down.
Okay, take this down.
No, yeah.
And
Now
go back to Zoom.
click the video, right? Click the video again on Zoom. On Zoom. Click the video again. And you're gonna share the sound. Yeah, click share sound to the bottom.
Okay, so I need to open this up.
Yes.
How do I open this back up?
You're in Zoom. Let's say share video. You go to the bottom where it says the arrow, share screen.
Okay, all right,
And you
1 sec. I see where it is, but I can't get to it because my screen is too small. But,
close the
okay.
screen. Close the screen first.
Close it.
Close that screen. What you have on this? Stop staring.
Okay, stop sharing. Okay, all right.
While we wait for Dr.
But
Mitchell to put up
yes.
the video, invite someone to join in this great teaching. Thank you.
You see share screen?
Yeah, I see share screen.
Let's share screen now.
Hit share screen now.
Right?
Uh-huh.
You're gonna see something, you'll see the video come up on that small play.
Oh, I see it. I see it.
Okay, then you say share sound.
Okay. And then now I go to where I get the sound from, get the video from.
Right.
Okay.
It should come up with that same that short box.
Can you hear it?
No, we can't even see. We're not sharing it here.
Can you see the video?
We can't see it yet.
You
Hold
can't see it yet?
Dr. Monique,
Uh-huh.
email it to me. Let me do it right quickly.
Okay. All right. What's your email? Lindiana, you can talk while we're doing this.
Yes, I was inviting them to
Mm.
please share the link so that others can learn. Each one teach one. So you know someone with at risk for diabetes, you
Yes,
know
okay.
someone who can use knowledge, share it. So I am the president of Diabetic Association, and I want to invite you all to come and join Bahamas Diabetic Association, which is located at St. Gregory's Anglican Church Hall, Carmichael Road. We would like for you to come and join. And there we want diabetics to, we want the Diabetic Association to be the one-stop shop for education for all diabetics. We put on the second Tuesday in the month will be
Hello?
support group. The third Tuesday in
Uh-huh.
every month is our teaching session.
Okay. All right, I can send it right now.
So if you know someone with don't know how to manage their diabetes, tell them come and invite them. Hey, you need to be a part of Diabetic Association. Come and join us. So this ending of the year, when you see the new year coming, we'll be offering laypersons diabetic training along with diabetic educators. So training in diabetes. You need a number, I'll even give you my number. It's 424-2019. And the association number is 828-4192.
All right, I sent it, so he should be up soon. The video was sent, so he should be soon.
So the world theme for this year is Know Your Risk, Know Your Response. It's the slogan. And all of us need to know our risks. And having one of the biggest risks for diabetes too is losing limbs, poor circulation. So there it is. Okay, we'll go right into the video to save time.
Moving on now, diabetes, a disease that may frighten you, but at the same time it has become a common health issue. November 14th is celebrated as the World Diabetes Day, created in 1991 by the World Health Organization. World Diabetes Day aims at responding to growing concerns about the escalating health threats posed by the disease. It provides an opportunity to raise awareness on what needs to be done for better prevention, diagnosis, and management of the condition. This year's theme for the day is Access to Diabetes Education, that underpins the larger multi-year theme of access to care. Millions of people with diabetes around the world do not have access to diabetes care. People with diabetes require ongoing care and support to manage their condition. The theme also aims at urging governments to increase investment in diabetes care and prevention. According to statistics provided by the WHO, in 2021, approximately 537 million adults between the age of 20 to 79 years were living with diabetes. The total number of people living with diabetes is projected to rise to 643 million by 2030 and 783 million by 2045. Now, 3 in 4 adults with diabetes live in low and middle income countries, and almost 1 in 2, which accounts about 240 million adults living with diabetes, are undiagnosed. Diabetes was responsible for an estimated $966 billion in global health expenditure back in 2021, and yet caused 6.7 million deaths that year. Diabetes can be treated and its consequences can be avoided with proper medication and regular screening and treatment. However, many do not have the access to it. The question arises, how can I lower the risk of diabetes? Here are some of the simple measures that you can adopt in your day-to-day life to avoid the disease. Starting from controlling your weight, exercise more, and inactivity promotes type 2 diabetes. Tune up your diet with whole grain products. Skip the sugary drinks and choose water, coffee, or tea instead. Limit red meat and avoid processed meat. Choose nuts, beans, whole grains, poultry, or even fish instead.
So, listening to the video, diabetes and its complications, such as blindness, kidney failure, heart attack, strokes, and lower limb amputation, it brings about substantial economic loss to people with diabetes and their families. The health system and national economies, access to quality health care is a fundamental human right. Yet millions of people around the world still faces significant barriers. In accessing diabetes care, here in the Bahamas, there is significant barriers to accessing podiatric care for many persons with diabetes. Because we are very limited. And in the recent STEP survey done in 2019, only 23.9% of diabetics had their feet examined. In the previous year, we have only 4 podiatrists for the whole Bahamas. You hear that? We have 4 podiatrists for the whole Bahamas. And the Bahamas ain't just Nassau, so you can imagine the risk factors, who are all in private practice in New Providence. Only 1 podiatrist works at 1 government clinic once per week. There is none at PMH or geriatric. We definitely have some concerns about assessing podiatry care. You may have noticed Dr. Johnson is not here with us this evening, and he is unavailable due to his commitments to the by-election process. So we will have him at another time. Our speaker this evening is no stranger to us. Absolutely no stranger. Dr. Monique Mitchell has an impressive and is highly qualified to speak to us today. She is proud alumnus of the R.M. Bailey and the University of the Bahamas. She returned to university and obtained a Doctor of Podiatric Medicine from Barry University and completed residency at the Mount Sinai Medical Center in Miami, Florida. She is a board-certified wound specialist physician and a diplomat in the American Board and multiple specialists into prevention and treatment of diabetic foot, wound, and diabetic footwear. She is passionate about preventing low extremities, amputation, and preserving the diabetic feet for life. She is a member of the Caribbean region, the Foot International American Limb Preservation Society, Save a Leg, Save a Life Foundation, and other organizations concerned with ending avoidable low limb amputation due to diabetes worldwide. She is a trainer and a facilitator on diabetic foot and wound care for laypersons and health professionals. She has been employed with the Ministry of Health and Wellness for the past 35 years and is now in private practice at Family Foot Center. Help me welcome our speaker, Dr. Mitchell.
Good evening, everyone. Thank you so much, Lindiana. I appreciate you and appreciate you standing in the gap. Good evening, everyone. We're going to get started. I think I see Dr. Horsley and I see Dr. Taz and a number of persons. We're going to ask persons to just put their location in the chat so that we can know exactly where they're coming from and we can give them a special welcome from as we go through. So this evening, we're going to talk about one of my favorite topics, which is diabetic foot. I'm sure you know that by now. And we're going to talk about access to diabetes care, because that is the theme for the World Diabetes this year. And we want to make sure that persons understand exactly what that is and why we're talking about podiatry care as part of that theme. So we're going to specifically talk about saving limbs and saving lives and what our role is. It's not going to only be about me or what podiatrists can do, but we all have a role to play. Those are our objectives, and we're going to get started. So as we begin, the diabetic foot is something that persons always hear or talk about. Lindiana, can you give me a thumbs up, or everything is good? You can hear me and see the
Yes, we can hear
slide?
you loud and clear.
Awesome. Okay, so the diabetic foot is something that most persons, especially if you've ever been admitted to the hospital at Princess Margaret, that is a very, very common diagnosis that you will hear, the diabetic foot. And so persons would want to know exactly what that is. And so I thought to put it here so you know exactly what we're talking about when we talk about access to care, because we want to talk about preventing having problems with the diabetic foot. So we know what diabetes is. The video did an awesome job with covering that, as well as Lindiana did as well. But the diabetic foot talks about infection, ulcers, or destruction of the tissues of the foot in persons with diabetes. Now, usually these persons would also have neuropathy, which is a loss of sensation, and they would also have a low or no blood flow to the feet. And so let's review that again. I fancy myself a teacher. So infection, ulcers, and destruction or damage to the tissues of the foot. And these persons occur in persons with diabetes and who may have neuropathy and peripheral arterial disease or lack of blood flow. So we'll talk a little bit more about that. I wanted to share with you some of the pictures that we see every day, or faces of the diabetic foot, I would say. I try not to get the most graphic pictures, but try to give you just a little bit. So we can see here that you see most ulcers sometimes change in the shape of the foot, as well as a result of diabetes. So those are some of the pictures that we see every day. And here are some more. So it can be as simple as these nails, long, thick nails, ulcers that are very large, to many parts of the body. This is a first metatarsal, second toe, second and third toe, the side of the foot, and even straight through the foot. So we can see that when you say diabetic foot, that's a wide range of conditions that can occur. So let's talk about some of the facts. And Lindiana covered one of them already, that only 23.6% of persons had their feet examined. And this does not mean that those persons saw a podiatrist. That just means that they had their feet looked at by a health professional. Could have been the nurse or the doctor, primary doctor, or a podiatrist as well. So complications from diabetes, we heard in the video, is increasing worldwide. And every day as the numbers increase, the complications also tend to increase as well.
Dr. Mitchell,
80%.
excuse me.
Yes?
We're not seeing the slides.
You're not seeing the slides?
No.
Okay, let me go back and share again. Maybe. Okay. Hold on 1 second. Let me escape. And okay, I'm going to share again and see if that fixes it, okay? Share. Can you see it now?
Yes.
Okay.
That's good.
Yeah, put it on slideshow.
Okay. From
That's-
there, you can
that's
see it
good.
now?
See it
Okay,
very well.
awesome. Okay, I'm gonna try to, so those are so let me show you. So we'll do this one again because the other ones were just talking. Okay, so we talked about the definition of the diabetic foot. And so these are some of the pictures that we see for the diabetic foot. I don't know why. Okay. So there are some examples of persons of feet that would be considered the diabetic foot. So as simple as something like the big toe hair, ulcers on the toenail bed or the tip of the toes, any of those are considered diabetic foot. And so here are some examples as well. We can see from the toenails that are digging into the toes, maybe ulcers on the side to the tip of the toes, the bunion, as well as something through the entire foot. So we can see that the diabetic foot can be even more extensive, where there can be gangrene as well on the foot. So let's look at a little bit of the statistics about the diabetic foot. For example, Lindiana covered a little bit of it, talking about how many persons actually had their feet examined. So here, less than a quarter of diabetics had their feet examined in 2019, and I think that's still the same about now. And then complications around the world are increasing. In the Bahamas as well, we're seeing our numbers of amputations increasing, our admissions are increasing, and just persons presenting with ulcers are also increasing. So we can see that as the numbers of persons who have diabetes increase, we actually see more and more complications as well. I learned something this year with World Diabetes Day. They said that at least 60% of persons who are diagnosed with diabetes already have complications. So that's a lot of persons who are just being diagnosed and they already have complications. And so diabetic peripheral neuropathy actually causes a delay in persons seeking help. And the reason why is because they don't feel pain. Persons do not feel pain. So they tend not to come to the doctor as soon as possible until, they actually either see drainage or someone else in the family may see that there's a problem. And then that delays treatment. So 1/3 of the cost, the direct cost of diabetes, is seen in the lower extremity, the foot complications. So diabetic foot is the most common reason for admission to Princess Margaret Hospital. It leads to longer stay and worse outcomes, and of course, more cost. So we can see that this is very common. About 15 to 25% of diabetics will develop a foot ulcer at some time in their life. So if we have, for example, about 11.8% of our population is diabetic, an additional 6.8% is pre-diabetic. So when you add that all together, that's almost 20% of our population is diabetic, because 60% of persons with pre-diabetes will convert to diabetes within 5 years. If they don't do anything, if they don't change anything, within 5 years, they will convert to diabetes. So that 25% is a lot. And so they will all have, about 10% actually have an ulcer at any time, but 25% will have one in their lifetime. So healed ulcers actually commonly reoccur, and amputation risk is increased as a result of just having an ulcer as well. In fact, my favorite statistic in all of this is that 85% of diabetics get an amputation, who got an amputation actually had an ulcer first. So that gives me hope, because it means that if we prevent diabetics from getting an ulcer, we pretty much prevent them from 85% of them from getting an amputation. So tonight we're going to talk a little bit about how we can do that and how, working together, we can actually realize that goal. This slide is also one of my favorite, and it's also always gets a bang for the buck, because I'm sure everybody here knows what a pink ribbon is, and everybody knows what a blue ribbon is. Now, not so much no green, or that's like a burgundy color ribbon up, person up to the top there. But what this slide is saying is that persons who have a neuropathic or a diabetic ulcer or gets an amputation, more of them will die in 5 years than persons who have breast cancer or prostate cancer. And why this is significant is when we hear of breast cancer or prostate cancer, everybody gets concerned, and they alert and they're looking out for it. but nobody's concerned about the diabetic foot or getting an amputation. And more people die from that than die from amputation, die from breast cancer or prostate cancer. In fact, it's 78% of persons who get an amputation in 5 years will be dead in 5 years' time. Okay, it says every 20 seconds, a limb is amputated due to diabetes. I just wanted you to get a picture, appreciation for how long 20 seconds is. So I'm going to play this video for 20 seconds, and you just reflect on the fact that during this time, somebody somewhere in the world has gotten an amputation. It could be someone here, we don't know. So that was pretty quick. So 20 seconds. So every 20 seconds, somewhere in the world gets an amputation due to diabetes. So we want to prevent that from happening. We want to prevent these pictures that are on the screen, and we want to prevent amputations. And so we want to talk about why they occur in the first place. So this slide says know the why. Persistent, uncontrolled high blood sugar actually leads to those complications. It causes permanent damage or permanent changes to the lower extremity. The lower extremity is from the knee down, or the foot. That is considered the lower extremity as well. So non-healing ulcers, infections, and amputations can occur as a result. And so we can see these pictures here are pretty graphic, but we want to know why that happens. There are 5 changes that occur to the diabetic foot as a result of diabetes. And we're going to take a few moments just to go over them so you can have an appreciation for why this occurs. And you're going to see a common theme here, persistent high blood sugar, because it is not a one-time increase in blood sugar. It's high blood sugar over time actually damages the blood vessels and cause peripheral arterial disease or poor blood flow to the feet. This can cause slow wound healing, gangrene, and actual amputation of the lower extremity because there is no blood flow. We all know it's very common here that we say the life is in the blood. And so if we don't have blood flow, it's very difficult to heal a wound and to save a limb. Again, the persistent high blood sugar causes damage to the nerves. So we talk about the blood vessel. Now we're talking about the nerve. Okay, this leads to loss of feeling in the feet, numbness, tingling, burning, and it actually causes persons to, if you got stuck with something or you walk on something, you may not actually feel it. And so that is what the damage to the nerve does. And that's very common. Like I said, 60% of persons when they're diagnosed already have this nerve damage. And so we can see that this is very common. And just by having the nerve damage, it increases your risk for amputation. Changes in the shape of the foot. So this high blood sugar, again, can change. It causes the tendons to get tight, the ligaments, and can actually even affect the bones, causing the bones to wash out or change in shape. For example, this picture here down at the bottom, at the bottom here, you can see that the shape of the foot is completely different from what the average foot is because there's no arch here. Instead, there's bone protruding at the bottom. And that is why persons are at high risk for increased pressure, ulcers, and amputation when they have that condition, which is called Charcot foot. But also you can see up here, this person actually had an amputation, and this one here has a wound under the bone. And so those are all changes that can occur in the feet or the shape of the feet. The fourth area that the diabetes affects is actually the skin. So we can see on my far right, or maybe your far left, there's the dry, scaly skin or cracked skin in the heels in the middle. And then sometimes you have where the toes are matted together because of the infection in that area. And so all of these can increase your risk for infection because it provides an opening for bacteria to get into the wounds. Okay, here are some other pictures or examples of of cracks in the skin or breaks in the skin, and these can all occur in persons with diabetes. Now, the fifth area where diabetes affect the skin or affect the feet is actually the immune system. So we know the immune system are the fighters for our body. This is the defense force of our bodies. And the neutrophils are the ones that go to battle to box up the bacteria and to kill them so that they do not cause infection. But when the blood sugar is high, it actually affects the immune system. It stops it from being able to function. It prevents the neutrophils from actually working. They cannot function with that high blood sugar. That A1C, sometimes persons have 12, 14, above, normal should be 7, but that's a very, very high A1C. And so it increased the risk of infection. And so we can see from this summary slide here that the persistent high blood sugar affects the blood vessels, causing poor blood flow, the nerve, causing loss of sensation, the tendons, ligaments, and bones, causing change in the shape of the foot, and then it affects the temperature and moisture control, and it causes the dry, cracked skin that can actually eventually become ulcers, and then it affects the immune system. And so we can see this diabetes affects a lot of systems all over the body. We're only talking about the feet now, but it affects all the other systems in the body as well in the same way. So why is this important? Access to care. We're talking about World Diabetes Day theme about access to care. So seeing a podiatrist, research has shown that seeing a podiatrist saves limbs, lives, and healthcare dollars. And we're all about that today because we want to make sure that we are able to provide the care that we need. And Lindiana mentioned earlier that we do have a shortage of podiatrists here in the Bahamas and worldwide, actually. But we're significantly shorter because if you look at the ratio, it's probably like 4 in the entire country. So that's 1 per 100,000 or so. And so that's a significant decrease or the number, the ratio. So we see that seeing a podiatrist can decrease your risk of amputation and hospitalization. And in United States, in one study, they saved over $3.5 billion with podiatry care. So let's talk a little bit more about actually accessing this care and what this means to persons who have diabetes to save their limbs and to save their life. I think the first thing we need to do to improve access to care is to have a mindset change. We need to think of the diabetic foot as savable. You know, a lot of times when I first came home, and a lot of times with the older health professionals and doctors and stuff, a lot of them didn't think that we could save the diabetic foot. It was felt that it was inevitable for someone who have diabetes to lose their limb, eventually. But that is not the case. There's a lot we can do to prevent these ulcers and amputations from occurring. And I think the first thing we need to do is the way we think about the diabetic foot. You know, the foot is the most neglected part of the body, but we need to begin to think about it. And the first one I want to say we need to think of is a callus. Now, we all know, I'm sure maybe someone could tell me what callus is. You just open your mic and tell me.
Good night, everybody. The buildup of skin.
Okay, all right, good, excellent. So hard skin, and usually on the bottom of the feet, but it can also be on the top of the toes as well. Okay, so yes, so that's what a callus is. So we don't think persons may not think much about a callus, but I'm going to give you an example of why we should be thinking about it differently. I recently attended a seminar and they were talking about a callus is like a breast lump. Now, I bet you never heard that. I don't know about you, but I actually had a lump in my breast, like maybe 10, I don't know, a long time ago. And if I ask, I'm sure a lot of persons on this call would also say they did, or they know somebody who had a breast lump. And I don't know about you, but I know me. That was like shocking. And it didn't cause me to sit down and think and wonder. It caused me to rush to the doctor and get some treatment. quickly as possible, because I did not want to have breast cancer, or if I did, I wanted it to be treated as quickly as possible. And so for the diabetic foot, we must think the exact same way. When you see callus on the bottom of the foot, that means that there's pressure there, and under that pressure, there can be an ulcer. Once you see an ulcer, 85% of people who had an amputation had an ulcer first. So an ulcer is going down the wrong road, and then that can actually lead to an amputation. So callus then, in this first picture here, is that hard skin underneath the second toe and the big toe here. But this type of callus is clear, white, beige, maybe a little yellowish looking, but this is just pressure, okay? Now, when we look over to the other side, we see that this is a dark callus, okay? So when we see the callus looking dark, it is a blood rouge under the skin. So it's not on the top of the skin, so you can actually see it or touch it. It's underneath the skin, and it can actually be red, blue, brown, or even dark yellow. And so when you see that, that actually indicates that there is a wound under that callus. And here are some examples. For example, this callus to the top here, once I took the top of that, the hard skin off, this was the ulcer underneath it. Okay, and so the ulcer underneath, based on the healing time of that ulcer, that is what causes the color of the callus. So if it's a fresh wound, it's red, it's bleeding underneath the skin, it's going to be red. If it's a little older, it may be blue, it may be brownish, it may be yellow. And so when you see callus with a different color, okay, not the yellow, not the clear callus like this, okay, when you see it has a color, you know, even before it gets a color, you need to go and get to see the podiatrist or someone who can actually remove that callus. By removing the callus, you prevent the increased pressure, and you can prevent the ulcer from occurring. Oftentimes, and this is the second example, so underneath this callus was this ulcer here as well, okay? And so we can see a lot of times these ulcers occur or wounds occur, and they can lead to amputations because they may get infected, okay? So the first thing we need to do is change the way we think about a diabetic foot or the diabetes on the feet. And then if we have a callus, move quickly and see the doctor so that you can get that taken care of and prevent that ulcer and prevent that amputation. So the second thing is diabetic foot screening. This is critical. Every diabetic should have their feet screened at least once per year. And then based on what the nurse or the doctor finds, they may decide to screen you again, either within a month time, 3 months, 6 months, a year, based on what they see. And so so if you're diabetic and you have not had your feet screened for this year, nobody looked at your feet, it's time to get it done. Everyone needs to do that. And then what we do is we stratify, or we say, oh, this person is at high risk or low risk or, medium risk. We try to predict what will happen with them. So vascular testing is critical. We need to know if you have blood flow to the feet. Okay, this is something we monitor every year. So if you have good blood flow, then yay, we love it. If you do not, then there are things that can be done. We can refer you to the vascular doctor so that they may be able to intervene or give you more medication or something like that will help to improve your blood flow. Sometimes we just monitor it so that, if anything happens, we know what to do quickly. So improved blood flow can promote wound healing, prevent amputation, save limbs, and save lives. We all know that a team approach to everything is usually better than a one person doing it. And so interdisciplinary team approach to diabetes management is what we want to promote, because you have better results. You are more successful with saving the legs and saving limbs if you work together as a team. Health professionals with the family, the community, and the hospital, primary care, tertiary care, all of them working together. You see this long list on this other side here that is surrounding the person with diabetes. So we have the pharmacist, the podiatrist, the diabetes educator, the nurse, the doctor, the eye doctor, the dietitian, so many more, the endocrinologist, everybody here working together to try to save that person's limbs and their lives. And that is the best way that we can do it. Some of the things that we do not have yet that we would love to see is to have a rapid response team. Just like when you have a stroke or you have a heart attack or something like that, there's a team in Princess Margaret that actually responds quickly to make sure that your stroke does not proceed. They give you medication to break up the clot, or they may, there's whatever the cause is, they intervene quickly. And so we're saying the same thing would be important for the diabetic foot. So we can be skilled in treating infections, identifying and correcting if there's a blood flow issue, wound care, so that we can do it. And we need to start this in public health, in the community, so that when persons do have a problem, there's somewhere to send them. They don't go to A&E and sit there for 3 days waiting, to get to be seen. There should be quick response and eager to help that person. And one of the examples is they have I think in California, they have a hot foot line, it's an emergency line that you can actually call, and then that person would be seen kind of as an emergency. So we all have a cell phone. I bet if I ask right now, everybody on this call have a cell phone. Not one person here don't have a cell phone. And so we can actually use technology to help with monitoring the foot. And we can use, for example, this one here to the bottom where the person is standing in the sneakers. The tennis is a pressure mat. So it monitors what areas of the foot is actually receiving more pressure than the others and would be at risk for developing calluses. So we can provide something in their shoe, maybe insoles, or we can just get them special diabetic shoes so that they can relieve that pressure. This picture here with the temperature monitoring, so that both of these here are very good. Research has shown that by an increase in 4 degrees in any particular place on the foot can actually predict that is where the foot is going to break down, or that is where the person is going to develop an ulcer. And so we want to monitor. In COVID, we all had our own little personal thermometers measuring our temperatures to make sure, anybody coming to your house or whatever. So it's very similar to that, but measuring the foot, checking the different parts of the foot to make sure that the temperature is good and you're not at risk for developing any ulcers. And then the foot selfie is like my favorite, because all you need is your cell phone. I use this all the time with my patients. If they have a wound and they're not able to come into the office, I ask them, I challenge them, take a picture of the foot, just have good lighting, take a picture and send it. And then we would be able to look at it and say, okay, yeah, you could wait till tomorrow or come right away, or whatever it is, whatever the concern is, we can intervene at that point. Come to the office, go to the emergency room, whatever it is, we are able to tell them or give them instructions based on the picture that they sent. So there are many, many other ways to monitor the foot, but we need to institute some of these in our system. And like I say, I do the foot selfie already. And so a lot of other persons do it as well. You can do telemedicine, for example. Persons can call their doctor or their nurse and show a video of the foot. And that also will get a health professional to look at the foot. But technology, we definitely need to use it, and that will help to increase access to care. But no matter what technology we use or what else we have, our individual responsibilities, we cannot give that up. If you're diabetic or your loved one is diabetic, you must take responsibility to help them, help yourself or help them to be able to protect their feet. And one way to do that is to do a foot self-exam. Just like we do for women, we do a breast self-exam, and men too nowadays do a breast self-exam. You should do a foot self-exam. Look at your feet every single day, because if there is a problem, you will see it and you will be able to get help quickly. It wouldn't be 2 weeks, 3 weeks, 4 weeks down the road before you actually notice it. And then it helps you to identify problems and get help quickly. And it actually takes about 60 seconds. Like Nurse Raming said, we're going to be doing this training sometime in the new year. So you'll be able to learn how to do that for yourself as well. So we're getting close to the end. Here, I wanted to just bring this home with the fact that we all have a role to play. We have almost 100 people on this call tonight, and we all have a role to play. The community, in collaboration with us, persons who have diabetes and persons who do not have diabetes, we all have something we can do, contribute. Health professionals, of course, we want them to be trained and be able to do the screening and to be able to identify problems, send them to the hospital or wherever they need to do, provide care. Laypersons also have a role. For example, our patients need to be alert. They need to prevent injury or do not soak your foot in hot water. Okay? Do not wear shoes that are too small. Do not do bathroom surgery. If you have an ingrown toenail or if you have something wrong with the foot, go and see a podiatrist. Do not stay home and try to treat it yourself. Your feet are special, so you need to get them seen by a professional. Okay? So our family members need to assist persons with diabetes. Sometimes they cannot feel, they may not be able to see well because their eyes have been affected, their feet have been affected, they don't feel well, they may not have the sensation in the fingers even. Okay, and so we need to assist them by even just watching, looking at the feet every day for them. Commit to doing that. As simple as doing that. Look at the feet every day for your mother or your brother or your sister or somebody, a friend. That alone can save them and prevent them from getting an amputation. Our nail technicians, we know that they are in the front line. They see more feet every day. And we already heard the statistics on diabetes from the video as well, that almost 50% of people who have diabetes don't know they have it. So they may be going to a nail technician or going to get their feet done without even realizing that they're diabetic and that they need special care. So our nail technicians, we're also looking at training them to be a part of our workforce so that they will have the information to know what they can treat and what not to treat and how to protect the feet that they actually see. And then we have caretakers, persons who are in the home, who take care of elderly persons, take care of their family members, and so these caretakers are also important because they're the ones who are clipping the toenails or not clipping the toenails or taking care of the elderly persons or our parents or whoever it is. And they also need to know what to do and what not to do when it comes to the diabetic foot. So we all have a role. I bet you didn't think, how you think the children have a role? The children do. The children have a role. You see that they're in the center of the slide? They definitely have a role because I heard a wonderful idea a few months ago, or maybe ago, where, here's an idea. Why don't we train the children to look at their parents' feet or their grandparents' feet? And I can say as a podiatrist, oftentimes people come into our offices and they'll say, oh, my grandson saw the blood on the ground or the drainage, or they looked at my feet and they saw that there was a wound. And so the children definitely have a role to play. So we can train the children that they can also look at their parents' feet and make sure that they are in good condition. So we all have a role to play. We all have something that we can do. And I just want you as a participant tonight, if you feel that you can really, really be a part of the solution and not a part of the problem, then give a thumbs up. Okay, just go to your reaction and put a thumbs up in the chat so that you can be a part of the solution. There's a lot that you can do. Nurse Raming here is the president of the association. She's asking persons to join the Diabetes Association. You don't have to be diabetic. You just have to be concerned about persons who have diabetes. And so you can join and you can actually be an advocate for somebody who have diabetes, or you can actually commit to looking at somebody's foot, maybe once a day, once a week, however long it is. Commit to maybe filing someone's toenails or doing something like that, getting training so that you can actually assist them. So we can all do something. So we're a team. All of us here tonight, we can work together. Together, we can save limbs and save lives. but there's no way that we can do it alone. Healthcare, the health facilities or the health professionals, we cannot do it alone. There's no way. That's a reality, because we may only see them once or twice a month, or once or twice every quarter sometimes, maybe once or twice a year. But every single day that person is home with their family or they're home alone. So you need to take responsibility and look at your feet every single day. So if you didn't get any message for tonight, there's two things I want you to get. One is amputations are preventable. And two, you need to look at your feet every single day. Every single thing. If you did that one thing, you will definitely know that you can save limbs and save lives. And the most important thing is getting that blood sugar under control. If the blood sugar is under control, you will prevent these ulcers and amputations. So I didn't want to leave without saying where persons can get help, because I know sometimes within, they may not know where to go if you need help. So every Thursday, there's a free podiatry clinic at South Beach Health Center. I'm sorry, I did not put the phone number there. Somebody can look it up and put it in the chat, please. But there's a free podiatry clinic there. Dr. Johnson actually works there. They have a full team of nurses and Dr. Johnson who works there, and they'll be happy to assist you or anyone you know. You have to make an appointment. So you'll call and make an appointment to go in and see them. There are other podiatrists available in private practice. These are where I work. So I go to Freeport as well. And then the Family Foot Center and Bahamas Surgical is where I work. So I put those numbers there. But definitely, if you have a problem with your feet, or you know someone who have a problem, they need to have their feet examined as quickly as possible and get an intervention. Now, this is my last slide, and my last part of the slide says here, and I would like for you, if you could read that for me, please take off your shoes. So whenever you go to the doctor, take off your shoes and socks. This is an awesome reminder for the doctor or the nurse to take a look at your feet. They're very busy. They have a lot of patients and they have to look at the whole body. So you want to remind them to also look at your feet. So take off your shoes and socks. You can tell them, Dr. Mitchell, say, take it off. Take off your shoes and socks so that they can actually look at your feet. You looking at it every day, but whenever you go to your doctor, you need to take off your shoes so they can also take a look at your feet as well. So that's your second take-home message. Take off your shoes and socks. Okay, these are my contact information here. So you can also get me on WhatsApp, or our office numbers are there for you to see. So I'm gonna stop sharing, and then if you have any questions, I see a lot in the chat, a lot of high chat, but I don't know what they are. So I'm going to stop sharing, and if you have any questions, I'll be happy to answer them at this time.
Thank you, Dr. Mitchell, for an excellent, informative presentation. Yes, we have some chat in the chat. It says, not sure if you answered this question, but how do you control the blood sugar?
How do you control the blood sugar? Oh, awesome. So I did not answer that specifically, but it was covered in the video. So if you're diabetic, there are principles of managing your blood sugar. And one of them is, of course, eating a healthy diet, a balanced diet, where you control the amount of carbs that you're eating. And we like to use a plate where half of your plate is vegetables. It could be raw and cooked. And then the other quarter is the starch and quarter is protein. And controlling the type of carbs that you're eating. Try to avoid highly processed carbs from like sweet cookies and cakes and biscuits and stuff like that, because they don't have enough fiber to keep you. Also avoid like the white rice, white bread, white pasta. Try to use more whole grain carbs so that they'll take a little while longer to process and they don't get into the bloodstream so quickly. I see Mr. Bo. I'm in Freeport next Thursday, the 30th. So sorry. So make sure what you're eating a healthy diet. Number two, avoid sweet drinks and like sugar sweetened beverages, sodas, all of that thing, because they put your sugar up quickly and will cause a problem. Make sure that you're exercising. At least 30 minutes a day is good to keep that blood sugar under control. If you are on medication, we recommend that you take your medication as prescribed by your doctor, and then regularly monitoring. You're checking your sugar at home, be a finger stick, going to your doctor's office, checking it, and then also getting a blood test. Your HbA1c is the monitor for how well your sugar is controlled, and we like to have that done at least once per quarter, no more than 6 months, so that we know exactly how well your sugar is controlled. And so if you haven't had it yet for the year, then when you go to your doctor, you ask them for it and it will tell you, and it should be less than 7. So I think those are some of the ways that you can control your blood sugar.
Yes. There's a comment say I'm so happy that I'm not alone. Know that I'm not alone in this walk. I really need more information. I am interested in being a part of the association, yes. So together, unity is strength. And you can manage, you can be in control of your diabetes. Take care of your God's temple, take care of your health.
Awesome.
Someone also put in the chat about wearing fingernail polish and toenail, having their toes done. But you could wear a little fingernail polish, but if you have fungus, you need to have it properly cared for. You have to really manage your feet. Love every day. Take care of your foot. I mean, examine them, massage them, make sure they're dry between your toes. Because moisture can cause fungus to grow. And if you have on the hot shoes all day, then you know what's going to happen. No tight shoes. Diabetics should go up a size in their shoe. Okay, probably you need to get wide with shoes. If you check Dr. Mitchell, she also have shoes at her office. Nice support shoes. Listen, you only have one pair of feet. It's not too expensive. You must wear proper shoes. Not no rubber slippers where nail could go right through it. You need support shoes. You must your feet have to support, carry your whole weight.
For
You
your
could
whole life.
imagine, yeah, standing. So you need support, hard support shoes. No tight shoes. No tight stockings. You see the sock, even the socks tight. So when you look, you leaving the mark. You need circulation, good circulation to go down into your feet. You need to get up every hour and take a walk, massage, rotate your ankles. You could kind of feel them swelling. Massage feet, elevate the feet, go get up and move. You don't want that pooling of the blood.
I wanted to just mention the polish as well. It's okay to wear nail polish if you have healthy nails, like Ms. Raming said. But we want to caution persons not to wear them for too long. Okay, I'm finding a lot of persons, especially the gel polish now, persons wear these polish sometimes 5 months, 6 months, and a lot of times when they take them off, you may have a fungus under there or some damage to the nail as well. So we say to persons, you can wear polish if you choose to, but you need to take them off regularly to check your nails and to check your feet. So I would say no more than 3 weeks to a month that you should wear the polish at one time. Take it off and look at it. When you go to the nail salon, sometimes persons go to the nail salon and the nail technician put on one polish over the next polish over the next polish. So they never get to look at their toenails. And so we want to encourage persons to just take off the polish and look to make sure that their toes and their feet are healthy. Lindiana, can you check the chat? Because I saw a couple of questions in there. Let me see.
Yes. One question here say, as far as I am aware, I don't have diabetes, but I get the clear callus from time to time. Do I need to check this out?
Okay, so callus, like we said, is caused by pressure. So wherever you're getting pressure on the feet, you're going to develop callus. So if you have the calluses in this area here, where they're under the bones, those are called the metatarsal heads. And so when you walk or you stand, you're getting more pressure in those areas. So sometimes persons get callus at the tip of the toe, okay? And that's because they have what are called hammer toes. And so when they have hammer toes, the toes are not flat anymore. They're bent like this. And so on the tip of those toes, that's where you develop the callus. And wherever you have callus, that means extra pressure and the possibility of an ulcer in that area. So yeah, so if it's bothering you as you're not diabetic, if you're managing it, and you can do that by periodically shaving the callus down by using a pumice stone or a foot file, like that, when it's soft. And then you can also wear supportive and cushioning shoes like Ms. Rami was talking about, making sure you have good insoles in them, and making sure. But as a diabetic, you need to come in to get that done. You don't need to, if you're not diabetic, you can go ahead and try and manage it. But as a diabetic, you need to come in. I spent a good couple of minutes talking about the callus because that's important. That's really, really, really important. And diabetic shoes are important, making sure you are wearing the right type of shoes, that you're not getting too much pressure on the toes or on the bottom of the feet as well. And so that's good to make sure. And wearing a diabetic shoe is really important. If you can get a diabetic shoe, we actually have a lot of diabetic shoes for men. We don't have any left for women, but we have quite a bit for men. So if you know a man who needs a diabetic shoe, they are absolutely free. You can give them our number, 605-3668, and they can come by and pick one out. If it fits, then they can have it, but we want to encourage persons to get the right type of shoes, because that's such a big area. Lindiana, someone is asking for you to repeat the phone number again.
Okay, the Bahamas
for
Diabetic
Diabetic
Association number is 828-4194. That's 828-4194. Presently, we only have a cell phone number, but as time goes on, we will get another number, a land.
Good night.
Good night, Mr. Gray.
I had a question. So I wanted to find out, is it all right to sleep in compression socks? No.
No, you don't need to sleep in the compression socks, because the compression socks work when you're standing or sitting with the legs hang down. They help to push that blood back up into the leg. And so when you're sleeping, as long as you're sleeping on a flat surface now, you're sleeping on a bed. So if you're sleeping on a bed or a flat surface, you don't need to wear the compression socks. You can take them off at night and just go like that. So you don't need to wear them, because they're not going to be working anyway, because the foot is not hanging down and it's not pushing against gravity. So no, you don't have to wear them at night at bed.
Someone is asking about what is the normal glucose
level.
Or what can be, what glucose numbers, and it also someone else asking what can be done for cracked heels. As far as I don't have diabetes, but they have cracked heels.
Okay, so the first question is, what is a normal blood sugar level? So we know that our blood sugar fluctuates based on what we eat. And so the amount of food we eat and when we eat affects the blood sugar level. But a fasting blood sugar, so if you first thing in the morning, when you check your blood sugar after not eating for about 10 hours, so overnight, your blood sugar should be less than 100 is a normal blood sugar. Less than 100, 70 to 100 is a normal blood sugar. Once you go over the 100 to 125, that is considered pre-diabetes. And then if you go over 126, that's considered diabetes, or that's diagnostic of diabetes. Of course, your blood sugar rises after you eat. So after eating a meal, within 2 hours after eating, you expect that that blood sugar is going to be up. And so after 2 hours, you expect it to go back down because the insulin has worked and taken that sugar out of the bloodstream and sent it back down to normal. So I would say between 70 to 100 is a normal blood sugar. Oh, and then the crack heals. So like we saw in persons with diabetes, it is affected by the temperature and moisture control. But we also have that in persons who are not diabetic based on our behavior. So if we wear like slippers all the time, or our foot is exposed all the time, we do not moisturize, stuff like that. So a lot of persons may have cracks in the heel based on their behavior. So what you can do about it is regularly. You can, when you bathe or shower while the skin is moist, you can use an emery board or a foot file to smooth down the rough callous skin. And then you can use a cream to moisturize it. You can put on, I would say, use urea, a cream that has urea in it, UREA in it, that helps to scale it off. And you can find it in a lot of different types of lotions like Jergens, extra dry skin, stuff like that. And so we also carry the actual urea cream at our office, so you can also come by and get that. And then if it's really, really bad, then I would say come in and let us shave it off and then get you on a regimen for how you can manage it. I would say also use the moisturizer at night, put on a sock. You can use shea butter oil, cocoa butter, a coconut oil. Just make a nice mixture, moisturizing mixture, and put it on at night, and that'll help to keep the moisture in. Put a sock over it, and then over time, it'll get back to its normal condition based on how long you had it.
Hey, one
You're
comment here
welcome.
say, you guys need to start a financial committee and find some supporters who will whose will to assist the cost of diabetes is a very expensive disease, and it requires you to have this, eat that, drink that, this and all that. Yes, it's expensive, but listen, we have to think before we eat. Um, you have to make healthy choices. Do I buy soda or should I just drink water? Healthy choices, plan your meals, try to exercise. You have to monitor your blood glucose. Start off with the fasting in the morning. Based on that, you kind of know what you could eat, if you could cheat or not. So, you portion your food. Think before you eat. Think before eat. This makes sense. Why have a chocolate when you know you need lunch? You time to eat lunch. So healthy choices, exercise, drink a lot of water. It's just called to love yourself. Taking time out for yourself. Massaging, taking time to examine your skin and really drying the creases in your body, drying your feet, massaging your body, and really taking time out to love oneself and to walk. As you go walking and stuff, you meditate and you burn off that excess glucose. And everybody needs a glucometer machine, right? Every diabetic should have their own machine. And so we want you to join the Bahamas Diabetic Association. We plan, our membership is $35 a year, but we plan to really be that advocate for you, to lobby so that we can get this prices discount at various pharmacies on diabetic care. So if we get enough members, and then we could lobby where even Dr. Mitchell may give a discount for you to see the podiatrist as they are short. But at the Diabetic Association, we also gonna be, for members, we're gonna be doing foot assessment. And we'll be there because we are a multidisciplinary team of diabetic educators that is running the Diabetic Association, and we'll be able to help you to monitor your diabetes, and really improve your health. So we want to be the one-stop shop in the Bahamas. We're starting off small and we're gonna grow. We're gonna grow and we want to see better outcome because we care. That's the thing. We really, really care about people.
I want to answer a question. I think Stacy is asking about a meal plan. So Stacy, if you would give us your number, we will pass it on to our nutritionist, and you would have you can have a consultation with her, and you can have a specific meal plan for you. So she'll teach you how to make sure that you are eating properly, what you should be eating, the amount you should be eating, and all of that. Okay, that is what you need, because we don't have a blanket or a generic meal plan. The general guidelines are that you eat a healthy diet, a balanced, a healthy diet, the fruits, the vegetables, making sure that your plate is balanced, protein, lean protein, and some healthy carbs, not processed carbs. So if you want to eat a piece of sweet potato or cassava or something like that, you eat a small piece of that rather than eating noodles or something like that. Okay, that is processed. So those are the general guidelines. And instead of giving a meal plan, we don't do that anymore. We try to teach you how to eat within your budget and within what you have available to you. Somebody already mentioned the cost, and so we want to get persons in the habit of using what they have and to be able to make that as healthy as possible. And so if you can leave us your number, Stacy, we will get you in touch with Miss Smith, who is our nutritionist, and we will get you to her so that you can get a good meal plan for you and how that can work for you. Okay.
Another question say, do you have to be a diabetic to join the association? No, you don't. Because yeah, you could we all are at risk for diabetes, and so
You just me put them in the box. No, I see you do nothing in the box. I see you move the box.
You can mute for us, please. You can
Put them
mute.
in the box. No.
PC, this person here, let me mute them. Okay, go ahead, Miss Rami.
yeah, so you don't have to be a diabetic to be a member of the Diabetic Association. You have to just want to care, because we all are at risk. If you have a family history of diabetes, if you are genetic, you pass it on through the chains. Your
Lifestyle.
lifestyle, obesity, you're at risk if you have non-communicable diseases like high blood pressure, cancer, lupus, all that have you at risk for diabetes. Just the color of our skin makes us at risk for diabetes. And our culture and the way we eat, all of that contributes. So you don't have to be a diabetic to be about. I'm not a diabetic, but I'm the president of the Diabetic Association. But we care, and true education is key, and we all know someone living with it. So we all have family members, so we have to be wise. Education is key, and we share and we learn and we help one another so we can have a healthy Bahamas. And that's what's most important.
Okay, we have another question here. What causes foot toe pain when there is no ulcer? So there's a number of conditions that can cause toe pain. So one of the first ones I think of is neuropathy. So some persons have neuropathy. They may not be diabetic, but they may have other risk factors for neuropathy that can cause pain in the toe. You can have an injury. You can have just the shape of the toe. Sometimes people have hammer toes and they're in bad positions, and so you get pain based on that. Arthritis. So there are a lot of conditions that can cause pain in the toe. So that is not related, definitely related to diabetes. The office is located at St. Gregory's Church off Carmichael Road. Just as you pass KFC on Carmichael Road, I think it's the next left. I think it's the next left on the left hand side. It's a big church.
Yellow and white.
Gregory the Great,
right,
yes.
right before the preschool, right before the primary school.
Yes.
And Gregory the Great Anglican Church.
Okay, so we'll get, as a matter of fact, our presentation next month, which is scheduled for the 14th of December, is going to be on nutrition. So make sure you pay attention to come back next month, because last year, Shandira Smith did our presentation, and it was like overwhelming success. So we're gonna have her come back next month to do that. And I definitely want to invite you to come back. But Stacy, I see your contact information. I will send that on to Miss Smith so that you can make contact with her. Okay, if there's anybody else on the call who would like to ask a question, you can just raise your hand. If not, we're going to get ready to close.
Well, I see a lot of compliments in here, and someone said they would like to join this Diabetic Association. We welcome you. Just give us give us a call. My number also is 424-2019.
All right, if you also want to be put on the list for our next month reminder for the meeting, you can just put your number in the chat. We will take a note of it. I work at the Lucayan Medical Center in Freeport on East Sunrise Highway, and I'll be there next Thursday on the 30th of the month. So we'll see you then. Okay.
Yes.
Play your information.
So we want to thank the 100 of you all who came on chat. So I think, Dr. Mitchell, we're going to need to have 200 Zoom of, so we just want to, we just grateful for you being here. So thank you so much for attending the meeting tonight, and have a good night. Please go and subscribe to our YouTube channel. It's Feet4Life 242. Share the address with your friends and family and ask them to subscribe. So our next meeting is Thursday, December 14, 2023 at 7:30 p.m. right here on Zoom and Facebook. So see you there. And we will have our closing prayer where we just invite the Lord to just guide us and give us a good night's sleep and a better tomorrow.
I think Pastor Raming is still there, so he can give us our closing prayer.
Let's pray. Father in heaven, thank you again for this powerful and important presentation that we have had. Thank you for each person that is on this Zoom call. And I ask that you will keep each of us healthy, keep us alert, keep us supporting each other and checking on each other. And I pray, Lord, that you will help us to prosper in our health as you desire us to prosper. Give us a wonderful night's rest and help us, Lord, to enjoy the night's rest and help us to wake up again in the morning so that we'll have another day with our family and friends, we ask. In Jesus' name we pray. Amen.
Amen. Thank you, Pastor Raming. Thank you, audience. And till we meet again. Good night.
Very
Good
good.
night.
Good night.
Night. Good night.
Good
night.
job, Raming.
Good
Good
evening.
night.
Very excellent
Good night,
program.
everybody.
Excellent program.
Good night.
Thank you. Thank you.
Good night, everybody.
Good night.
Good
Thank you
night.
so
Good
much.
night. Good night.
Good night.